On March 3rd, St. Lucia joins the global community in observing World Hearing Day 2026, the largest annual advocacy event dedicated to raising awareness about hearing loss and promoting ear and hearing care worldwide. This year's theme, Communities to Classroom, Hearing Care for All Children. It reminds us that protecting children's hearing is a shared responsibility, one that begins at home, continues in schools, and is strengthened by our communities. Since 2022, the Ministry of Health, Wellness and Nutrition has actively supported ear and hearing care initiatives, standing alongside international partners to advance accessible and equitable hearing health services. Globally, hearing loss among children remains a silent and often overlooked challenge. According to the World Report on Hearing 2021, approximately 90 million children and adolescents aged 5 to 19 years are living with hearing loss worldwide. Many remain undiagnosed and without access to services they need, especially in low-resource settings. Yet hearing loss in children is often preventable and treatable. The common ear and hearing conditions in children are otitis media and impacted earwax, both of which can significantly affect a child's hearing if left untreated. In 2025, 674 children below the ages of 16 years were screened at the hearing clinics at the Entrepot and Viewfort Wellness Centers. When a child cannot hear well, the impact extends far beyond the ears. Hearing loss can interfere with speech and language development, learning, academic performance, behavior, social interaction, and self-confidence. Over time, this may limit educational achievement, employment opportunities, and the overall quality of life. However, over 60% of childhood hearing loss is preventable through simple, cost-effective public health measures. For this year's Hearing Day observance, the Ministry of Health, Wellness and Nutrition is prioritizing two key areas. Firstly, preventing avoidable childhood hearing loss. By strengthening early identification, routine screening, and timely referral systems, we aim to ensure that preventable and treatable conditions are addressed before they interfere with a child's development and learning. Secondly, leveraging schools and communities as platforms for action. Schools and communities are natural entry points to reach children, parents, and teachers. Integrating ear and hearing care into school health and child health programs allows us to create supportive environments where children can hear clearly, learn effectively, and achieve their full potential. The Ministry of Health, in collaboration with other partners, have planned several activities to mark this important observance, to include training sessions for teachers, parents, and healthcare professionals on early identification of hearing issues in children aged 5 to 18 years. school-based hearing screening at 3 selected schools, and heighten public awareness through various media platforms in an effort to educate communities on ear health, the signs of hearing loss, and the importance of early intervention. These activities will promote early detection and prevention of hearing loss in children and form a structured screening and referral pathway. Hearing plays a pivotal role in communication, learning, behavior, social development, and overall well-being. A child who hears well is better positioned to succeed in school and in life. The Ministry of Health, Wellness and Nutrition reaffirms its commitment to early detection, inclusive education, and quality ear and hearing care for every child.